Hi everyone, thanks for joining us for our rerun of our initial webinar focusing on our Level 2 Technical Award in Health and Social Care. For those of you that joined us for the original webinar, you'll be aware that we had a few technical issues, which is why we are rerunning the webinar to ensure that all of you get the information that you need. So I'm going to be handing over to Claire Montague, who is Health and Social Care Subject Specialist here at CASH, and Claire will be talking you through the qualification, giving you more information on delivery and how you can ask us some further questions if you have any. So over to you, Claire.
Okay, thank you, Marcus. Hello, everyone. This webinar will introduce you to our Level 2 Technical Award in Health and Social Care, which the Department for Education has approved to count in the 2020 Key Stage 4 performance tables. There will be an opportunity to explore the structure and organisation of the qualification, as well as content, delivery and assessment requirements. These certs are technical alternative qualifications to GCSEs at Key Stage 4, holding Departments for Education performance points. These certs are the ideal fit for your curriculum as they have been designed to slot seamlessly into timetables alongside course subjects. They are eligible to be counted in the open group for school accountability measures and support Progress 8 and Attainment 8. These sets are appropriate for learners aged 14 to 16 years who are motivated and challenged by learning through hands-on experiences and through exploring content which is concrete and directly related to those experiences. They offer equivalent levels of rigour and challenge to a GCSE with clear progression routes and career pathways, be it general, technical or applied. Specifically, we developed the Level 2 Technical Award in Health and Social Care in response to education drivers, reform and market need. Technical qualifications meet the needs of learners who want to get a foothold on the vocational career ladder. This programme of study promotes widening participation through vocational opportunities for further study. The qualification will enable learners to develop knowledge and understanding of the sector and be introduced to skills, attributes and behaviours in relation to best practice in health and social care. Therefore, the qualification gives a broad and sufficiently in-depth base from which Level 2 learners at Stage 4 in their compulsory education can begin to make informed decisions concerning future career goals and aspirations. Learners may wish to study the Level 2 Technical Award in Child Development and Care alongside this qualification, as it serves as an introduction to child development and wellbeing. Both of these qualifications will provide a starting point for learners to decide whether a career in health and social care and or childcare and education is right for them. So let's begin through examining the structure and organisation of the qualification. The qualification has a total qualification time of 140 hours, of which 120 are guided learning. It consists of 3 internally assessed units and 1 synoptic external assessment. The units are TAHSC1, Introduction to the Health and Social Care Sector, TAHSC2, Professional Practice and the Health and Social Care Practitioner, and TAHSC3, Human Growth and Development through the Life Stages. Within Unit TAHSC1, Introduction to the Health and Social Care Sector, learners will explore types of provision to include functions and purposes, job roles of health and social care practitioners, access and referral procedures, ever-changing care needs, formal and informal care provision, and regulation and inspection. For Unit TAHSC2, Professional Practice and the Health and Social Care Practitioner, learners will consider responsibilities, skills, behaviours and attributes of health and social care practitioners, professional practice, professional development, legal frameworks, values and guidance, components of person-centred practice, teamwork, partnership working and career pathways. Finally, within Unit TAHSC3, Human Growth and Development through the Life Stages, learners will be introduced to the stages of development from conception through to birth, potential effects on development of preconception, pre-birth and birth experiences, life stages to include infancy, childhood, adolescence, early, middle and late adulthood, holistic development, theoretical perspectives, factors impacting on human growth and development, transition and significant life events across the lifespan, and finally the role of care planning in relation to meeting individual needs and promoting well-being. For each unit, learners will be required to apply knowledge and understanding through a mandatory assessment of learning, a mark scheme which will be subject to internal and external quality assurance. To gain the qualification, learners must achieve a minimum of a pass grade in each of the 3 internal mandatory assessments, as well as the scenario-based short answer examination being the externality. The qualification is graded pass, merit or distinction, and there is no compensation between internal assessments or between internal assessments and the external assessment. Each unit consists of learning outcomes with associated content, which details the knowledge and understanding which must be delivered. However, you may wish to include other relevant content outside of this. The unit guidance provides amplification of these mandatory teaching and learning requirements for clarity. Now, we have developed a tutor guidance document. The tutor guidance includes schemes of work, hints, tips and teaching aids, as well as links to useful websites. It is envisaged that this non-mandatory resource will provide you with a range of tools to assist you with your planning and delivery. Please do be creative and innovative. Approaches you could use include visits and guest speakers, practical workshops, peer mentoring, and use of online materials. Staff need to be occupationally knowledgeable to deliver this qualification. Where there are any queries around this, please check with your external quality assurer. Various resources, templates, pro formas and policies are available to support delivery on QualHub and the members area of the website. Learners at Key Stage 4 are beginning to explore vocational career-related journeys. As you are aware, the qualification has been arranged into 3 units. Each unit includes new learning through focused outcomes, subsequently challenged through a criterion-based mark scheme, as I said, called a graded assessment of learning. The assessment of learning shows how the learner can achieve the criteria and gain the grade. It requires the creation of a portfolio of evidence. A portfolio of evidence allows flexibility and is learner-centric, therefore taking account of individual learning styles and needs. A range of assessment methods can be used. The example you can see here shows what the learner must do to achieve each grading criterion, showing the grading criterion for the pass level. The learner must achieve all of the criteria for a grade to be awarded. A higher grade may not be awarded before a lower grade has been achieved, although component criteria for higher grade may have been met. The internal assessment, as I said, will be graded pass, merit or distinction, and of course will be subject to internal and external quality assurance. Each learner must achieve a minimum pass grade outcome to achieve the unit. In order to secure a pass grade, learners must show an application of knowledge and understanding across each learning outcome, which reflects the breadth of the unit content. Merit and distinction grade outcomes build on theory and concepts relevant to the qualification. Equal weighting for the unit has been allocated to show an appreciation of discovery, application and theoretical conceptual exploration for learners at this stage in their statutory learning. There is no bias to any particular unit. All 3 units are necessary to encourage learner participation and initiate interest in this vocation. The external assessment is synoptic. It requires the learner to combine elements of learning and show accumulated knowledge and understanding across the 3 units and their learning outcomes. This allows learners to integrate and apply knowledge and skills with breadth and depth. All content, so that's 100% from the 3 mandatory units, TA, HSC 1, 2 and 3, is subject to external assessment through a synoptic, scenario-based short answer examination. Now, this method of external assessment requires learners to apply theory and concepts from the learning outcomes in context to show knowledge and understanding of the subject at the appropriate level. Of course, the synoptic scenario-based examination will allow for application of knowledge and understanding from across the units and combines content to develop holistic connections. The scenario-based short answer examination will consist of a mixture of multiple choice questions, short answer questions and extended response questions. The synoptic external assessment contributes to 45.5% of the qualification grade. The scenario-based short answer examination again will be graded pass, merit or distinction. Once more, learners must achieve a pass grade in order to gain the qualification, alongside, of course, a minimum of a pass grade in the 3 internal assessments. Please see the qualification webpage on our secure site for a sample scenario-based short answer examination and mark scheme. Within the qualification, there is a maximum of 1 further attempt for learners to take the scenario-based short answer examination in order to achieve a pass grade or to improve a grade. This will be a different scenario-based short answer examination. At Key Stage 5, learners may choose to progress to the next level of learning in health and social care. We have a range of related qualifications which hold performance points, namely our Level 3 Applied General Award and Certificate in Health and Social Care, as well as our Level 3 Technical Certificate and Extended Diploma in Health and Social Care. Within our offering, we also have a range of competency-based qualifications which learners may pursue. Of course, if you would like more information on the Level 2 Technical Award in Health and Social Care, or how we can support you with your own curriculum planning, we'd be very happy to talk to you. We run free training courses throughout the year, and you can also request a bespoke training day that will be tailored to your needs and delivered at your centre. Alongside performance-pointed qualifications, we also offer a range of qualifications in health and social care which are suitable and available for pupils from the age of 14 but do not carry performance points. More information on these qualifications can be found on the CASH website. Obviously, as you know, we're sending you the slides from this presentation, and within the email we have included an option for you to request a call from a member of the team. I do hope that you found this overview useful, and we'll now consider some questions that were raised yesterday.
Thanks, Claire. Yeah, so just to take a quick opportunity to go through some of the questions that we received and answered during the original webinar at this point. So the first question that was asked us yesterday was, are the qualifications available for 19+ learners?
Okay. Yes, the Level 2 Technical Award in Health and Social Care is available for learners post-16. So although it was designed primarily for Key Stage 4 learners, anyone post-14 is eligible for registration. We do not set any other entry requirements, but centres may have their own guidelines.
Great. Okay, so the next question that was asked is there any training specific for the qualification available?
Yes, there is training available. We run national training courses throughout the year, and there's also an option for you to request a bespoke training day, which means it can be tailored to your needs and also delivered at your centre. For further information regarding our available events, please visit the members area of our website.
Great. Next question. How is the technical award different to the Level 2 extended diploma?
Okay, so the Level 2 technical award in health and social care enables learners to develop knowledge and understanding in relation to the sector, and learners can register, as I said, from 14 years of age. The qualification has been approved to count in the 2020 Key Stage 4 performance tables. Whereas the Level 2 extended diploma in health and social care is suitable for learners aged 16 and above, and who wish to progress into further education or into the workplace. The qualification covers a range of key subjects in health and social care and also includes a bank of optional units which allow learners to pursue an interest in a chosen subject area. It does not hold performance points. So really it's looking at Key Stage 4 and Key Stage 5.
Great. The final question is this a knowledge only qualification?
Yes, it is a knowledge only qualification, therefore no work placement is required. Throughout delivery, learners will be introduced to skills, behaviours and attributes that are applied in the sector in relation to best practice. So therefore, learners do need to be given the opportunity to hone technical skills through simulated classroom activities, which will allow application of knowledge and understanding. But yes, it is a knowledge-only qualification.
Okay, thanks, Claire. That rounds off the final question that we received yesterday. As Claire's mentioned, if anyone who was not available to attend the original webinar but has some questions that they would like answered from our field team, then please do get in touch. If you receive this webinar via email, you'll have an option to get in touch with us within the email itself. If you're just viewing this webinar later on down the line, then please do pick up the phone and give us a call, and we're more than happy to answer any of your questions. So thanks again for viewing our webinar, and we look forward to seeing you again in the near future. Bye now.